to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. I am thrilled to have Jeff Schemansky here today with me for this episode of Ask the Patient Advocate. In our current age of healthcare, it is important to have an advocate to help navigate for you and your loved ones. And part of advocating is having the proper resources to support your conditions and diagnosis and management. And our episode today is focused on IV therapy. On Ask the Patient Advocate, I haven't really talked much about my clinical experience. I started working clinically as a physician associate over 15 years ago, and then later earned my doctorate of medical science degree. Jeff works with me clinically as he offers mobile IV therapy, and that's what we'll be covering today. Hi, Jeff. Thank you for joining me. How are you doing today?
Of course, thank you. I'm doing good. How are you?
Good. Thanks for asking. So I specifically asked Jeff to join me on Ask the Patient Advocate because IV therapy can be beneficial to so many people. Often people with chronic conditions or people that are experiencing symptoms may find relief with IV therapy. And Jeff is so knowledgeable in IV therapy. So I'm very, very excited to chat today with you.
Me too. Thank you, Alana. Me too.
So Jeff, can we start by having you tell us a bit about your background and what made you get into IV therapy?
I got into the medical field over 10 years ago. I became a paramedic and I work on a full-time fire department now as a firefighter paramedic. I worked in the ER for a while and got experience there. I've always liked emergency medicine. I'm a firm believer in that. And then like long-term care, which to me would be more of the holistic style and preventative medicine as well. I think IV therapy and nutrition, all that plays a role. And I always worked on side projects, and I got this ambulance on eBay and I was like, what can I do with this? And I was going to sell it because I got a good deal on it, but I ended up keeping it. And I thought, it would be cool to do like IV therapy out of it. And so I started, I looked into it, and because I'm a paramedic, we can do IVs and medication administration. We work underneath the doctor and everything and follow protocols just like as a paramedic, except through IV therapy and vitamins. But anyways, yeah, started drip drop ambulance, and that's kind of how I got started doing IV therapy.
That is so awesome. What an interesting story. That's great. I love the whole ambulance idea and just kind of growing it from there.
Yeah.
Yeah, that's really cool. So IV therapy has gained recognition over the past few years, but there's a lot of people that still are really unclear of like what the process is. So can you walk us through like how an IV therapy appointment at someone's home would work? So like if I said, called and said, hey, I'd like to, have you come to my home and give me a IV therapy treatment, how would that look like, or what would that look like?
Yes, typically I would want to know the reason why would you like IV therapy. And as long as we're not really treating anything, more than happy to help them out with an IV, confirm with the doctor that this is the reason why they want an IV. They fill out a quick intake form, and if they're eligible for the IV. So always safety measures first. We can give them an IV and we can add vitamins to it to get them feeling better. So they would call, set up an appointment. I go over there and we hook them up with an IV, and I'm usually in and out of there in about an hour or so.
That's perfect. That's awesome. So, okay, like some questions that I think I would think about if it was my first time doing it. Like, is there a specific spot you have to insert the IV? Does it hurt? Kind of things like that. How would you?
Yeah. Well, I've been doing IVs for a while. Like, I got a lot of experience doing IVs in the ER, and so, I mean, IVs can't hurt. And sometimes you bruise, sometimes you don't. It depends on the person. But typically, I go for your main. It's called the antecubical vein. It's like the one where your elbow's at, right there in the crease of your elbow. That's a good one to go for. But sometimes in the forearm or even the hand. But I ask the person, where would you like the IV? Joke. Sometimes people are like, can you put it in my feet or something? No, not in this situation. But people do put it in their feet, so not in IV therapy, but always like the hand, forearm, or that anacubical vein, which is by the elbow there.
Very cool. And so let's kind of walk through how a person feels after. Like, what's a common response that clients share after having tried an IV? What are
Yeah. Yeah. If they need the IV, they usually feel relief right away and hydrated. Again, it depends on what they're want the IV for. You get a whole wide range of reasons. People that want to boost their immune system because they don't feel good, they have a cold, even the flu, we can give people IVs. Now, we're not really treating them, we're helping them out by boosting their immune system. So for that instance, like, someone calls because they have a cold or the flu, we're going to help give them vitamins to boost their immune system. Or if they went out real late and they were drinking and they could be hungover, IV therapy really helps with that. They're getting the big bag of IV fluids and we're giving them vitamins to help overcome that hangover feeling. And then, but people that have been sick, sometimes that it's usually a gradual feeling. That's the most feedback I get from people is they do the IV, they feel pretty good after throughout the rest of the day, but then it's the next day and the following days for like the rest of the week, they just feel better and better as the week goes on. But I've had people call me the next day and just say, I don't know what you gave me, but I feel like a complete 180 turnaround from how I was feeling yesterday. I feel hydrated, I have energy, and they just feel a lot better.
I think that's such an important point because, some people ask me like, well, if I get an IV therapy today, then is it only going to last for a couple hours and then I'm going to feel back, to like have no energy tomorrow? And I'm like, I think it's important to point out, like you did, that it does kind of build and it's a slow progression, which is nice because you're feeling good for quite a few days afterward as well.
Absolutely. You're right.
No, that's great. Okay, so as far as the IV therapy compared to like oral vitamins, I'm sure that's a question that you get asked a lot. What can you tell people when they ask how it compares? Like, how does IV vitamin therapy compare to oral?
Yeah, I think it depends on their supplementation and them at like where they are at on, I want to say, like a wellness scale. Why are they taking vitamins? Is it for maintenance? Are they trying to replace a deficiency? But it does different from IV therapy because when you take like an oral vitamin, it goes to your gastrointestinal tract, so you're only absorbing a certain percentage of that vitamin. So they say, according to science, 20, 30, 50%, if that, of the actual vitamin versus IV therapy. It's directly into your vein, into your bloodstream, 100% absorption on a cellular level.
Yeah, I think that's so important because a lot of times people will come and ask for IV therapy, and their GI system isn't working 100% like it's like they would want it to be. So maybe their absorption is or their metabolism is not as strong and things like that. So I think it even heightens the reason for IV therapy because even if they're taking these supplements, it doesn't necessarily mean they're being absorbed and utilized by their body as they would like them to.
Absolutely. It depends on where, like the absorption and where they're at with that vitamin deficiency and how much they need it. Because you have, again, people that call not only because they're feeling like not good that day, like I was saying, like a cold or a flu or being hungover, but you have people like athletes that want to maintain their IV therapy intake. So they'll do like a vitamin once a month or every other week or something like that, just for maintenance.
That's perfect. And I know something that we can kind of talk about in another future podcast talk, but there's ways of testing, like, how is your body absorbing those needed vitamins and things like that. And, what are your levels? Are your levels adequate? But then a step further, diving to see, like, okay, maybe you're taking the right amount of like oral supplements, but your body's not absorbing it as needed and things like that. So there's definitely a deeper dive that can be taken if you continuously are interested in doing these IV therapies or increasing your overall vitamin intake and things like that.
Absolutely. I agree with that 100%. I think that the general over health and wellness of the person too, because I like IV therapy or preventative medicine because they're treating like the whole person.
Agreed.
And yeah, you need to start with like check your vitamin levels, your nutrition, how are you sleeping? All that plays a role.
I agree with that. I think and traditionally or years ago, the thought of when I thought of medicine, even before I started practicing medicine, you thought of like, okay, you have a symptom, you have a diagnosis, take a pill and it should get you better. And now, over the years, I think it's been highlighted and reinforced more and more, especially in recent years, that it doesn't work that way. Because if your body is not functioning how it's supposed to, it really can't overcome and adapt or respond to medication, or you maybe don't even need medication if your body's able to fight it off on its own. So really starting from the core and making sure that your body is as healthy as possible and keeping it hydrated and with the proper vitamins and supplements and things that it needs to fuel itself, that will optimize its performance on all aspects.
Exactly. Exactly. That's why I always let the people that I do IVs for, let them know, hey, follow up with a primary care doctor, holistic doctor, someone like that you can take it further and go more in depth, because we're kind of just, here's some vitamins and fluids, but it does help and make a difference, because I give the main vitamins that are just your most popular ones that your body needs and deficient in. Yeah.
I think that's a great point. And I think too, it's like, you know, for myself, the first time that I tried IV therapy, I was, a little skeptical, wondering like, how am I going to am I going to notice a difference? I overall, I consider myself fairly healthy. I definitely could increase my intake of certain vitamins and minerals, etc. But I will say, when I tried it for the first time, I was amazed at how I felt afterward. I did feel in the sense of energy. I just felt, it's kind of not the best description, but I just kind of felt healthier. It's crazy how to explain it, but I was very, very impressed. And ever since then, I've been definitely supportive of it. So that's great. Nice, nice. No, I think it's great. I definitely am an advocate for that for sure. Okay, so fun question. What's your favorite vitamin? If you had to pick one, what would you pick?
Oh yeah, vitamin C, spelled with the SEA, so the ocean, vitamin C. My favorite vitamin. No,
Oh,
I'm
I
kidding.
love it. No,
No, probably B12.
B12.
Yeah, yeah. B12 is an interesting vitamin. It's made from bacteria. Like, people think that animals make it. They don't make it. It actually is made from bacteria. It's hard to come by unless you're always eating a lot of animals. But even then, some animals are supplemented with it.
Interesting.
Yeah, and I do give B12 injections. So I give methylcobalamin. So cobalamin means B12, and there's methylcobalamin and cyanocobalamin. Cyanocobalamin is a synthetic form of B12. Methyl is more natural, and I carry methylcobalamin. So and I do like that one. It's great for energy, metabolism, immune system health, all of it. And I think it's an important vitamin to supplement, whether you're getting IM shots, which is intramuscular injections of B12, or you're taking it through supplementation, so the vitamin form pill.
That's awesome. No, I think that's great. And I like how you explain that, because I think that's a big question for a lot of people that have looked at all into B12. Is like, there's two different forms. How do I know, which one is better and things like that. So I think that's really important to kind of understand the difference. No, I think it's great. I think, like some people, are gonna want to know more and ask questions, and then obviously others won't. But for me, I like knowing the details of why things are chosen and things like that. So, and I
Yeah,
think you, you know, I see as clients continue to utilize the IV therapy, they have more questions and want to know a little bit more and things like that. So I think that's good that they're getting that information.
yeah, me too. How about you? What's your favorite vitamin?
So I love magnesium. So I think magnesium is good in so many ways. It helps with sleep. It helps with constipation. It's good for your bones. It can help reduce stress and anxiety. Those are just like a few. But it's funny because years ago, I worked with a trauma surgeon, and he was very, very like well-known trauma surgeon. And when I first started working with him, he we would have these traumas. So these patients that were very, had all kinds of injuries. And I remember every time I would talk to him about a patient, like, hey, we had this trauma patient come in, I did this and this, and, he's gotten these injuries and I have him on this medication. The only thing that he would ask me in the beginning was like, what's his magnesium? And I'm thinking, why does he care about,
Hmm.
of all the problems that this patient has? Why
Yeah.
is he so concerned about this magnesium? I mean, that's not a typical question you get from a trauma surgeon, right?
Right.
And he actually had started, he had practiced for many, many years, and he had started to really look into functional medicine and was really interested in supplements and things like that, and different, and vitamin therapy and all of that. And so he would always tell me, even if the magnesium is normal, we should give him more magnesium because it would help in so many aspects. And I learned so much from him because I never really appreciated the value of magnesium until I started working with them. And I would see the patients would very often do, it would help them kind of recover a lot of times, but just by making sure their magnesium was optimized.
Yeah.
It was cool. So that was kind of when I first really got introduced to the benefits of magnesium. Before that, I didn't appreciate it as much. So now I
Oh,
do.
for sure. Well, that's how a lot of vitamins are. Magnesium, you're right. It really supports muscle recovery. I mean, athletes, magnesium, very important mineral, and other vitamins that affect or that help with aging, glutathione, muscle recovery, your vitamin C, and all those vitamins play such a huge role in recovery.
Yeah, and it's interesting to learn too. I think it's great when you start realizing oh, this is why I need this vitamin and things like that. Because even the vitamins and supplements that you can get through diet, which not all of them you can, but many of them you can, you're just taught as a child, you need to eat this because it's good for you, but you don't really know what does it do for me? And you kind of get a very basic understanding, but when you look into it further, you're like, oh wow, these are pretty cool things. They do they're pretty smart. Vitamins and supplements, they do a lot for my body. So I think you just learn how to appreciate them more.
Hmm. Hmm. I agree.
So okay, so I know that we have discussed this, you and I, in the past, but I thought it was something important to bring up and share with the listeners. So there are so many IV therapy companies kind of popping up because it's becoming more well known and people are really responding to it. So what are some things to be cautious of when trying IV therapy? In a new location or a new provider. What are some things that make a good IV therapy stand out versus one that maybe is not so not the best.
Yeah, that's a good question. I mean, the only company I kind of, I guess, would be to what I look at the business that I work under with. I want to say I know I run this IB company, so I'm always looking what I can do to kind of improve. Some other companies people tell. Well, I guess I can give you feedback from what I've heard. Maybe I don't know what to say, but others. But they'd be like, I like that you explain things, and because I do, everything that I get comes directly from the pharmacy. Everything I get, I open everything up in front of the patient in a sterile, environment. So everything is sterile. All your vitamins, the needles I use. Then I use the vials and I show them the vials of vitamins that I have, and I use the alcohol to clean them. And then I'm drawing everything up in front of them. And I'm like, I follow a strict protocol. This is the protocol. Sometimes I show them it and I go, it says draw up, 3 to 5 mLs of vitamin C, let's say, right? So vitamin C, I can give 3 mLs or I can give 5 mLs because it says in the protocol, give between 3 and 5. I'm going to give 5 because I want to hook them up the best I can because I want them to feel a difference. So I give them as much as I can. I explain it to them and I add the vitamins in the bags right in front of them. Like, oh wow, I've been other places they don't put them in the bag in front of me. They leave, they come back, and the vitamins are in the bag supposedly. I'm like, no, I do it in front of you. And then I do the IV pushes. So that's where you push the vitamin directly into the IV line. Some people are like, well, I never had what you call an IV push right there. I'm like, yeah, in my protocol, it says do a couple of these IV pushes and add some to the bag. So I like to do that. That's just the feedback I get. And and then the people will say, they'll be like, they'll use me again and say, I notice a difference with the vitamins that you give me versus if I go to this place. And I don't know if they're not getting enough, like they're not just doing enough vitamins, or maybe again, it's how they felt that day when they went in there. They could have been feeling really good. They get the vitamin therapy and they're like, okay, I feel good for a few days after, but then maybe they happen to see me on a day where they were pretty dehydrated. They get an IV bag for me. And then they're like, wow, I feel a lot better. It's because maybe they just needed the IV. I don't know, but that's just, you know.
I think you don't, I think, you are a huge factor of why people, keep wanting to come back to you. I think it's really important to build that relationship with the person that's doing your IV therapy. You feel more comfortable. You kind of learn like what your client likes and things like that. And I think you can kind of help with further things being, you depending on how they responded to one, whether they may benefit from changing it or repeating the same type of therapy and things like that. I will also, to kind of add on to what you said, I think there is a noticeable difference in if somebody uses a vitamin that's maybe past the due date or past the expiration date, I feel like you don't feel the same effects of it. It's not as effective. I know from a personal experience I did that one time and I felt like I wasn't aware at the time, but it's the vitamin was actually expired, and I noticed there wasn't I didn't get that same feeling that I did from when I typically got ibuprofen.
Yeah, it loses its potency.
Exactly, a nice way
Yeah.
to exactly, it loses its potency. And so when you are having IV therapy by the same person, you trust them, they trust you, and you have more of a you have a better outcome.
Yeah, and like again, when I show them the vials, I do it in front of them. I don't leave and draw. And some going to their location because I like to do mobile. I did have an office for a while, still kind of do right now. Get into that later though. But the mobile, yeah. Say here, this is a vial of vitamin C, and sometimes they want to see it, and I want to make sure that the date is good on it, and I always confirm the date, even when I document. I go a little bit above and beyond with the charting, and I put the lot number of the vial, and then I also, the expiration date and how much of the medic or vitamins I gave them.
That's perfect. I think that's helpful too. Like when you do go back, you can kind of like look to see what they got last time and things like that. So I think that's really important as well.
Yep, and that's something different that from other companies that I've kind of shadowed and worked with. We didn't do that. But that's documented, and I guess however you prefer it as a business and how you want to document things.
Sure. No, I think that's really important. I appreciate that you sharing that with everyone. So, again, thank you, everyone, for listening, and thanks, Jeff, for joining me today. It's always great talking to you. And if you're located in Michigan and you're interested in scheduling an IV with Jeff, you can call 248-266-1355. And we'll also post his website at Drip Drop Ambulance. You can look at that as well. If you're outside of Michigan, feel free to contact us at advocate@pathwaypa.com, and we can kind of help you with further resources as well. Anything else you want to add, or is there anything you want to say before we close, Jeff?
Thank you for having me.
Thank you for joining us. All right. Have a great day.
If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.